We're going to teach you a little bit about strokes. Strokes, also called cerebral vascular accidents, CVAs, happen when there is an inadequate amount of blood flow to the brain. This results in a lack of oxygen. Necrosis then develops. This means the brain starts to die.
Hey, this is my grandma. She had a stroke about 4 years ago, and I'm just going to ask her a few questions about her experience with that. So Grandma, can you just give us a quick summary of your stroke? When did you first you were feeling, you had a headache, right?
Yeah. Some of it I can't remember
You can't
too much.
remember?
Yeah.
But it was a bad headache, and it was flu season,
Yeah.
so you didn't really think too much of it.
No.
And how long did that go on? A couple days?
Yeah.
And so when we got to the hospital, they just thought it was double pneumonia.
Yeah. They ran a bunch of tests, and they found out there was other things that were wrong,
Mm-hmm.
and they found that I had a stroke.
Yeah.
There are two main types of stroke. Ischemic, which is the most common type of stroke, occurs when the cerebral artery is blocked by a clot or other foreign material. This stops the flow of blood. Hemorrhagic, the second most common, happens when there's a rupture in the artery that causes bleeding within the brain. We can use the acronym FAST as a diagnostic tool. F stands for face. Look for that droopiness within the face. A stands for arms. You can't move them, or other extremities such as your legs. S is for speech. Your speech can be slurred. Time means time is of the essence. Call 911 as fast as you can, because within 5 minutes it can prevent serious damage to the brain. The stroke scale measures consciousness, senses, motor commands, speech, and language, and is a way of assessing if a person is going through a stroke. Physical examinations of blood tests, MRIs, and CT scans are also used as echocardiograms are used to identify if a clot in the heart traveled to the brain.
The etiology of stroke, or the causes of it, include modifiable and non-modifiable risk factors. Non-modifiable risk factors are things you cannot change. This includes diabetes, hypertension characterized by continuous high blood pressure, hyperlipidemia, which is high cholesterol, atherosclerosis, increasing age, obstructive sleep apnea, various heart diseases, an autoimmune disorder known as lupus erythematosus, a family history of strokes, and gender and ethnicity can be correlated to an increased risk of stroke, such as being male or African American. Modifiable risk factors of stroke are things you can change. This includes obesity, physical inactivity, excessive drinking, drug usage, smoking, and hormones like those found in oral contraceptives.
Okay, so we're going to talk about some clinical manifestations that you may observe with a stroke. Common signs and symptoms include facial drooping, so you can ask the patient to smile, one-sided weakness, speech difficulty or confusion that they may be having. Your patient may have a severe headache. They may have decreased cognition or a sudden loss of vision. So if you see any of these signs and symptoms, that's just something that you need to be aware of, and it's better to be safe than sorry, so do not hesitate to call 911.
Okay, so now we're going to get my grandpa's perspective on the events that happened.
Oh, I don't know. He had terrible headaches, and I couldn't get her to go to the doctor. And then we took her to Marysville, and then they moved her to Manhattan. And They called me about 1 o'clock in the morning, said she had a stroke, and went down there, and I didn't know what was going on. She couldn't hardly talk, and couldn't move her arm and right side.
A silent stroke is a stroke in which you may have no symptoms present until permanent damage has already occurred. And an evolving stroke is a stroke that can develop over a period of hours or weeks.
Taking a patient's health history is important to rule out other diseases. Questions a healthcare provider might ask are: when did symptoms begin? Certain treatments are dependent on time frame. Recent history of trauma to the head, which could increase brain damage. History of a previous stroke. A patient is at a higher risk for stroke if they've had a previous one or a TIA before, and if they have any seizure activity. How soon you receive treatment after a stroke is correlated to the extent of brain damage. Remember, time is brain tissue. For an ischemic stroke, you need emergency treatment with medication. This includes clot-busting drugs to start within 4.5 hours of stroke. An example is tissue plasminogen activator, or TPA. This is ideally given within 3 hours of the first signs of stroke. This restores blood flow by dissolving the blood clot. Another form of treatment is emergency endovascular procedures. These are procedures performed directly into the blocked blood vessel. This includes medication delivered directly to the brain, a catheter through an artery in the groin, or a thread to the brain. Another form of treatment is removing clot with a stent retriever. These are beneficial for larger clots unable to be dissolved by TPA. Other procedures include a carotid endarterectomy, which removes plaque from arteries along the neck to brain. An angioplasty and stents, which is when a balloon is inflated to expand the narrowed artery, while the stent supports the opened artery. For a hemorrhagic stroke, treatment focuses on controlling bleeding and reducing pressure in the brain. If the patient is on blood thinners, they will be given drugs or transfusions to counteract the bleeding. Surgical blood vessel repair can stop blood flow by surgically clipping or coiling. Surgical clipping involves clamping at the base of the aneurysm to stop blood flow. Coiling is when a coil is guided to the aneurysm with a catheter and blocks the blood flow.
So on to recovery of stroke. It's important to remember that every recovery is different for every stroke patient. So just be aware that not everyone may have the exact same recovery. It depends on how much of your brain has been affected by the stroke. So a patient is likely to have a rehab team, which includes nurses, neurologists, therapists such as physical therapists, occupational therapists, and maybe a social worker.
And then they moved her to Marysville, and she had speech therapy and other 2 therapies.
So they focused on being able to pick up things again and
Yeah, my right side was affected.
When she got up there, it wasn't too long, they was having her try to walk up and down the hall, and she couldn't even walk down to Manhattan. Had to have her in a wheelchair, push her to her therapy room, and they had to hang on to her and everything. But she's back on halfway,
Yeah.
not completely, but
getting there.
yeah. She had the OT for, I don't know, about 3 months.
Basically, the overall goal of the patient's rehabilitation is to regain their ADL functions, regain their independence, stuff like that. So we're just going to talk about a couple ADL functions. Swallowing and eating. This can be difficult for stroke patients, so they would have a speech therapist. As far as toileting goes, the goal for these patients is to regain continence and establish good habits. Dressing, something important to remember is to always dress the affected side first and undress it last. That'll just help you get these patients' clothes on a lot easier.
Okay, now can you talk a little bit about how this has affected your activities of daily living, how it's changed?
I don't do the things that I used to do.
Right. Can you give
Makes me mad.
Can you give an example of something?
Can't drive the car. Can't cook the way I used to. Can't give the people static I want to.
Oh, I think you still do that.
Not like I want to.
What do you want new nurses to know about people who've had strokes?
I guess they need to pay more attention to like how the patients feel and what their needs are. And
What do you wish they knew?
Understand how they. Oh, it's hard to.
Hard to put into words.
Yeah.
Yeah. Maybe have them understand how that it's scary and
Yeah.
frustrating.
Yeah.
So sometimes it might just be nice to be patient with them
Yeah.
and try to understand where they're at.
Yeah.